Are you curious about the uses of haloperidol? In this video, we will explore the primary conditions treated by haloperidol, dosing information, potential side effects, and even user feedback. Haloperidol is a commonly prescribed medication that belongs to the class of antipsychotic drugs. It is often used in the treatment of various mental disorders, such as schizophrenia and bipolar disorder. Additionally, haloperidol may be prescribed to manage severe agitation and hallucinations associated with dementia. When it comes to dosing, it is important to follow the recommendations of a healthcare professional. The dosage can vary depending on the specific condition being treated and the individual's response to the medication. However, it is crucial to note that haloperidol should always be taken under medical supervision to ensure safety and effectiveness. As with any medication, haloperidol may cause certain side effects. These can range from mild, such as drowsiness and dizziness, to more serious, such as neuroleptic malignant syndrome, NMS. It is important to be aware of these potential side effects and to consult a healthcare professional if any concerns arise. To get a better understanding of haloperidol from a user's perspective, we will also include feedback from individuals who have taken the medication. This will provide valuable insights into the experiences and outcomes of using haloperidol. Stay tuned for an in-depth exploration of haloperidol's uses, dosing, side effects, and user feedback. What is haloperidol? Haloperidol is a medication that falls under the category of antipsychotic drugs. It is commonly prescribed to treat various mental disorders, including schizophrenia and bipolar disorder. Additionally, it can be used to manage severe agitation and hallucinations associated with dementia. Haloperidol works by affecting certain chemicals in the brain, helping to restore balance and alleviate symptoms. Haloperidol is available in different forms, including tablets, liquid, and injections. The specific form prescribed will depend on the individual's condition and their healthcare provider's recommendation. It is crucial to take haloperidol as prescribed and under medical supervision to ensure its effectiveness and minimize potential risks. Primary conditions treated with haloperidol. Haloperidol is primarily used in the treatment of several mental disorders. One of the most common conditions treated with haloperidol is schizophrenia. Schizophrenia is a chronic mental disorder characterized by hallucinations, delusions, disorganized thinking, and abnormal behaviors. Haloperidol helps reduce the severity of these symptoms and improve overall functioning in individuals with schizophrenia. Another condition for which haloperidol is prescribed is bipolar disorder, also known as manic depressive illness. Bipolar disorder is characterized by episodes of extreme mood swings, ranging from manic highs to depressive lows. Haloperidol is often used alongside other medications to help stabilize mood and prevent the occurrence of manic or depressive episodes. In some cases, haloperidol may be prescribed to manage severe agitation and hallucinations associated with dementia. Dementia is a progressive condition that affects cognitive function, memory, and behavior. Haloperidol can help reduce agitation and relieve distressing symptoms in individuals with dementia, although it is important to carefully weigh the potential benefits against the risks in this population. Dosing information for haloperidol. The dosing of haloperidol can vary depending on the specific condition being treated and the individual's response to the medication. It is crucial to follow the recommendations of a healthcare professional and never adjust the dosage without their guidance. For the treatment of schizophrenia, the initial dose of haloperidol for adults is usually 0.5 to 2 mg per day, administered in divided doses. The dosage may be gradually increased based on the individual's response and tolerance, with the typical maintenance dose ranging from 5 to 20 mg per day. It is important to start with the lowest effective dose and closely monitor for any adverse effects. In the case of bipolar disorder, haloperidol is often used as an adjunctive medication. The dosage may vary depending on the specific needs of the individual and the severity of their symptoms. It is typically started at a low dose and adjusted as necessary to achieve symptom control while minimizing side effects. When it comes to managing agitation and hallucinations associated with dementia, the dosing of haloperidol should be carefully considered due to the increased sensitivity of older adults. The initial dose is usually 0.5 to 2 mg per day, with close monitoring for response and side effects. The goal is to find the lowest effective dose that provides symptom relief without causing excessive sedation or other adverse effects. It is important to note that the dosing information provided here is a general guideline and may vary depending on individual factors. Always consult a healthcare professional for personalized dosing instructions. Common side effects of haloperidol. Like any medication, haloperidol can cause side effects. The most common side effects are generally mild and may include drowsiness, dizziness, restlessness, dry mouth, constipation, and blurred vision. These side effects are usually temporary and tend to improve as the body adjusts to the medication. It is important to inform a healthcare professional if these side effects become persistent or bothersome. In some cases, haloperidol may also cause movement disorders known as extrapyramidal symptoms, EPS. These can include muscle stiffness, tremors, abnormal facial movements, and difficulty with coordination. EPS can be distressing, but they can often be managed by adjusting the dosage of haloperidol or using other medications to alleviate the symptoms. Rare but serious side effects of haloperidol. While rare, haloperidol can potentially cause serious side effects that require immediate medical attention. One such side effect is neuroleptic malignant syndrome, NMS, which is a rare but life-threatening condition characterized by high fever, muscle stiffness, confusion, and irregular heartbeat. NMS requires immediate medical intervention and discontinuation of haloperidol. Another serious side effect to be aware of is a condition called tardive dyskinesia, TD. TD is a movement disorder characterized by repetitive, involuntary movements of the face and body, such as lip smacking, tongue protrusion, and uncontrolled limb movements. TD can occur after long-term use of haloperidol and other antipsychotic medications. It is important to monitor for signs of TD and report them to a healthcare professional promptly. Haloperidol may also increase the risk of developing metabolic changes, such as weight gain, high blood sugar levels, and elevated cholesterol levels. It is important to regularly monitor these parameters and make necessary lifestyle adjustments or consider alternative treatment options if needed. User feedback and experiences with haloperidol. To gain a better understanding of haloperidol from a user's perspective, it is valuable to consider feedback and experiences shared by individuals who have taken the medication. While everyone's experience may vary, these insights can provide valuable information about the efficacy and side effects of haloperidol. Many individuals who have taken haloperidol for schizophrenia report a reduction in hallucinations, delusions, and overall improvement in their ability to function on a day-to-day basis. Some users express gratitude for the medication, noting that it has significantly improved their quality of life. However, others mention experiencing side effects such as drowsiness, restlessness, and weight gain. For those with bipolar disorder, user feedback on haloperidol is mixed. Some individuals report significant improvement in mood stability and a reduction in manic or depressive episodes. However, others mention that the medication may not be as effective as other options or that they experienced uncomfortable side effects such as EPS. Individuals who have used haloperidol to manage agitation and hallucinations associated with dementia often report positive outcomes, including a reduction in distressing symptoms. However, it is important to carefully consider the risks and benefits in this population, as older adults may be more susceptible to certain side effects, such as sedation and movement disorders. It is important to remember that user feedback is subjective and may not apply to everyone. It is always recommended to consult a healthcare professional for personalized advice and guidance when considering or taking haloperidol. Precautions and warnings when taking haloperidol. Before taking haloperidol, it is important to discuss any pre-existing medical conditions, allergies, or medications with a healthcare professional. Certain medical conditions, such as Parkinson's disease, liver or kidney problems, and heart conditions, may require special consideration when prescribing haloperidol. Haloperidol may interact with other medications, including certain antibiotics, antifungal drugs, and medications used to treat heart conditions. It is important to inform a healthcare professional about all medications being taken to avoid potential interactions or adverse effects. During treatment with haloperidol, it is important to attend regular checkups and follow-up appointments with a healthcare professional. This allows for monitoring of the medication's effectiveness, any potential side effects, and adjustments to the treatment plan if necessary. Abruptly stopping haloperidol without medical guidance is not recommended, as it may lead to withdrawal symptoms or a recurrence of symptoms. If discontinuation is necessary, a healthcare professional will provide guidance on gradually reducing the dosage to minimize potential risks. Alternative treatments for the primary conditions treated with haloperidol. While haloperidol is a commonly prescribed medication for the treatment of various mental disorders, there are alternative treatment options available. Each individual's treatment plan should be tailored to their specific needs and preferences, taking into account factors such as the severity of symptoms, potential side effects, and response to different medications or therapeutic approaches. For schizophrenia, alternative antipsychotic medications may be considered, such as risperidone, olanzapine, or aripiprazole. These medications work in similar ways to haloperidol but may have different side effect profiles or efficacy profiles for individual patients. Additionally, psychosocial interventions, such as cognitive behavioral therapy, family therapy, and supported employment programs, can be valuable additions to the treatment plan. In the case of bipolar disorder, mood stabilizers such as lithium, valproate, or lamotrigine may be considered as alternatives to haloperidol. These medications help regulate mood and prevent manic or depressive episodes. Additionally, psychotherapy, such as interpersonal and social rhythm therapy, IPSRT, or dialectical behavior therapy, DBT, can provide valuable skills and support for individuals with bipolar disorder. For managing agitation and hallucinations associated with dementia, non-pharmacological approaches should be considered as the first-line treatment. These may include creating a calming environment, providing structured routines, and engaging in activities that promote relaxation. If non-pharmacological interventions are insufficient, low-dose atypical antipsychotic medications may be considered as alternatives to haloperidol. It is important to work closely with a healthcare professional to determine the most appropriate treatment options based on individual needs, preferences, and potential risks. Conclusion: haloperidol is a medication commonly used in the treatment of various mental disorders, including schizophrenia and bipolar disorder. It can also be prescribed to manage severe agitation and hallucinations associated with dementia. The dosing of haloperidol should be individualized and closely monitored by a healthcare professional to ensure safety and effectiveness. While haloperidol can provide significant relief for individuals with mental disorders, it is important to be aware of potential side effects, including mild ones such as drowsiness and dizziness, as well as rare but serious ones such as NMS and TD. User feedback can provide valuable insights into the experiences and outcomes of using haloperidol, although individual responses may vary. Before starting haloperidol or considering alternative treatments, it is crucial to consult a healthcare professional. They can provide personalized advice, consider individual factors, and help develop a comprehensive treatment plan that maximizes the benefits and minimizes potential risks. With the right approach and ongoing support, individuals can find effective management for their conditions and improve their overall well-being.